Adjumani district leadership, together with United Nations Women, convened a meeting on 12 February 2025 at Adjumani district chairman's office as part to respond to refugees and the hosting community's needs. During the engagement, the UN Women agreed to install a number of facilities, including hospitals and schools, as a part to bridge health and educational gap in Adjumani district. Kaijuka Arthur Richard, the deputy district chairman, 5, welcomed the initiative and said this has come in time in order to fit the current population of the refugees in the hosting districts.
Adjumani is a funny district. The number of refugees is equivalent to number of nationals here. Wow. Half. We are 200,000 plus nationals, and the refugees are also 200,000 plus. We have been oscillating here, South Sudan, here, we were oscillating. We were one of the refugees, the other side, they were even. So, my dear brother doctor, whatever you are doing to buy is desperately needed in Adjumani. Yeah. Because, for example, my dear people, we were talking of leadership, but the doctor is interested in school from his talk.
Pauline Chiwangu, representative of United Nations Women Uganda, said as there had been cuts on funding to support refugees, they are working closely with partners, Office of the Prime Minister Refugee Department, to ensure that refugees are sustaining their lives. She said they are planning to extend service to reach on ground for both the refugees and nationals among the 13 districts which hosts refugees.
So we are here as UN Women, and you heard what we do. We work on leadership for refugees, we work on education, second chance education, we work on skilling, we also work on livelihood. As you know, there have been a lot of cuts of what was supported to refugees. So we are really trying to work very hard with our partners, with our donors, to make sure that a refugee can sustain themselves, can have livelihood. So what we are planning, we work very closely with the government, the local government, the Office of the Prime Minister, because he's the coordinator, the Office of the Prime Minister, on all activities pertaining to refugees.
Taban Peter Latta, the resident district commissioner at Adjumani district, lamented the challenges faced by people while accessing health services in the district, adding that Adjumani General Hospital is 100-bed capacity, but currently it's overloaded since the refugees have stepped in.
We have one health center for is some 20 plus kilometers. Its referral is to these main hospitals. They don't have an ambulance. UNHCR tried to give some ambulance. Unfortunately, one of them got an accident. So now getting a person there referred here is another challenge.
He, however, committed to follow and monitor such development program in person.
As the chief monitor of this district, UN Women has done tremendous work. Through these partners, you have heard. It is true the number of women have gone high in leadership because of the training that they got money from UN Women. Refugee Law Project did great work. Women Overcomers has done great work in bringing leadership, governance, and other things, training, bringing our religious leaders, our cultural leaders, going down into conflict resolution, bringing us together. We cannot mention all. Waiteka has taken now the backbone. The backbone of Uganda is agriculture. Yes.
This will help the people of Adjumani district to reduce challenges of referrals and accessing education very cheaply, and the people of West Nile at large. Masidraru, Onjima Allen, West Nile TV, Nilecast.